Hi, this is Aaron with Aaron Cook Insurance, and this is Navigating Medicare 2025. This is part four of this series, and in the previous parts, we talked about what Medicare was, what it wasn't, what it did and did not cover, as well as how to find additional coverage to fill the holes that original Medicare left in our healthcare. We talked about the costs associated with Medicare, as well as how to choose a plan that best fit our needs. In part four, we're going to look at how and when to enroll in Medicare. We'll also look at when you can change your coverage. Finally, we're going to talk about some of the basic ways that you can save money with your Medicare coverage. Once you're ready to enroll in Medicare, you're going to want to navigate on a web browser to www.ssa.gov. It is through the Social Security Administration website that we are going to submit an application to enroll in Medicare. If you don't have a Social Security Administration account, you can create one at the bottom of the login screen. Depending on when your account was created, you will either log into your account using the username and password or using a login.gov icon. Once you are in your Social Security account, you will start a Medicare application. I am happy to walk you through these steps over the phone if you have any questions. Once you've completed the Medicare application, you will submit the application electronically, and the Social Security Administration will process this application for you. It normally takes between 2 and 6 weeks to receive a Medicare number. And even though your card is not being sent out yet, you will receive a verification code. With this verification, you can search up what your Medicare number will be. Even though you don't have your card, you'll still be able to enroll in any type of supplemental coverage or drug coverage that you wish for. So when can you enroll? Generally speaking, it's during the initial enrollment period that most people will become eligible for Medicare. The initial enrollment period happens around our 65th birthday, the 3 months prior to our birth month, and the 3 months after our birth month, plus our birth month itself. It's during this 7-month window that we can enroll in Medicare without receiving any late enrollment penalties. If you've already started receiving Social Security retirement benefits or Railroad Retirement Board benefits, or if you are receiving Social Security disability benefits for at least 24 months, you will automatically be enrolled in Medicare Part A and B, and no action will need to be taken by you. You will receive your cards in the mail a couple of months prior to your 65th birthday. Everyone else will need to enroll through the Social Security website using the process we talked about on the previous slides. If you wish to enroll in a Medicare Part C or Part D plan at this time, you will need to make sure that you have your Medicare card numbers. Again, these numbers do not require you to have your physical card just yet. An agent or broker will help you enroll in this plan if you need it. For everyone that missed the initial enrollment period, you will be required to sign up during the general enrollment period. Take note that if you have to sign up during the general enrollment period, late enrollment penalties may apply. You can have penalties for Parts A, Part B, and or Part D. We had talked previously about how if you wish to enroll in a Medigap plan, you may be subject to medical underwriting. The exception to this is during the Medicare Supplement open enrollment period. It's during this period that no medical underwriting will happen. Additionally, you cannot be denied coverage for a Medigap plan during this period. This period lasts for a total of 6 months and starts on the first day of the month you turn 65. It goes for a total of 6 months from the first of that month. Any Medigap plan that you apply for, you will be guaranteed coverage for, and that coverage will last as long as you continue to pay your premiums. This is a great benefit for people that really want the benefits of a Medigap plan, but are concerned about their health and feel they may not get qualified. In the event you choose to work past age 65, when you lose your employee health coverage, you will trigger what is called a special enrollment period. This will allow you to enroll in Medicare without any penalties up to 8 months after you have lost your coverage. It is important to note, however, that you only have 63 days to go without coverage of having drug plans. If you go more than 63 days without a drug plan, you will have a late enrollment penalty. This is important because even though we have 8 months to get Part A and Part B, we need to have Part A and Part B in order to enroll in our Part D. Make sure that when you are getting ready to retire, if you're retiring past 65, you time your Medicare application correctly so that you receive your Medicare cards or your verification codes in time to get your drug coverage within 63 days of leaving your employer coverage. So what happens if you're working past 65? Are you required to enroll in Medicare? No, you're not. Generally speaking, I advise my clients that if their Part A is free, which for most people it is, there's no downside to enrolling in Medicare Part A. It doesn't have any inherent disadvantages. Part B, because it charges you a premium, may not be required if your employer has 20 or more employees. Additionally, you need to talk to your employer and make sure that their drug coverage is considered creditable. This means that the drug plan they offers at least the basic benefits as offered by a Medicare Part D plan. Your HR department will be able to tell you if your drug plan is credible. Additionally, if you are covered by a spouse's employer, generally speaking, this is more than okay. However, some employers have rules around how dependents are covered once they are eligible for Medicare. So make sure you look through your spouse's insurance plan before making this decision. As we had talked about previously, there are late enrollment penalties for Medicare Part A, Part B, and Part D. For the most part, Part A and Part B premium penalties will fall off. The Part D, however, lasts a lifetime. This is one that does not go away, except in very few situations. The penalty for this is 1% of the average Part D premium for every month you delayed enrollment. For example, if you went a total of 10 months without drug coverage, you would pay a 10% penalty every single month for the rest of your life. It does add up quickly, and I encourage everyone to make sure that they do everything they can to avoid this penalty. So you've enrolled in Medicare, you have your coverage, but you're not quite happy. When can you change? For the most part, if you have a Medigap plan, you can change whenever you want. There are no rules around when you can change your Medicare supplement insurance. However, it is subject to underwriting. So it's something that if you want to change, you need to make sure that you can still be covered under the other plan that you want to get. For Medicare Advantage or for Part C or Part D plans, the normal time to change is the Medicare annual enrollment period. This occurs every October 15th through December 7th, and your new coverage takes effect January 1st of the following year. Medicare Advantage Part C and Medicare Part D prescription drug plan beneficiaries can change their plan as many times as they want during this annual enrollment. It is the last plan that they select that will take effect the following January. Additionally, the Medicare Advantage open enrollment period lasts from January 1st to March 31st, and this is available only to Medicare Advantage plan members. You will be able to enroll in a Medicare Part D prescription drug plan only if you are returning to original Medicare after having dropped a Medicare Advantage plan. Any plan that you choose during the open enrollment will take effect the first of the month following the month you enroll. For example, if you enroll in a new Medicare Advantage plan February 12th, that new Medicare Advantage plan will take effect March 1st. Unlike the annual enrollment where you can change as many times as possible, you are only allowed to change once during open enrollment. Occasionally, you will have what is called a qualifying life event. A qualifying life event includes most commonly moving or losing coverage. Losing coverage could be retiree coverage, could be a spouse's employer coverage, your union coverage, or your COBRA coverage. Additionally, if you remember when talking about the Advantage plans, one of the stipulations was that you lived in the service area. Service areas are generally based on county. So anytime you make a move, even if it's just across the street, but it is a different county, you will trigger what is called a special enrollment period. You have 2 months following the month of the enrollment period to make a change of your Medicare Advantage or your prescription drug plan outside of the normal enrollment periods without any penalty. How can you save money on Medicare? By far, the easiest way to save money is using your preventive services. For a full list of preventive services, navigate to www.medicare.gov. In 2010, the Affordable Care Act put in place a large list of medical services and tests that it considered to be preventive. It required all Medicare companies to pay for these plans at no cost to the beneficiary. This means that you will not pay for any of these services, even if your deductible has not been met. You will not pay any cost share for these services. These services include things like annual physicals and wellness checks, vaccines. They do include several diagnostic tests, and I encourage everyone to make use of these as often as possible. For the most part, the cost of these tests and services are already built into the cost of your healthcare. This means that if you do not take advantage of this, not only are you allowing the healthcare companies to retain some of your money that they've earmarked for you, but any potential medical issue is not being found until later when it is more serious and will cost more. Another great way to save money is using your plan's provider network. This goes not only for doctors, but also for pharmacies. We had talked about some of the HMOs and the PPOs with our Advantage plans, and making sure that we stay in network will ensure that we receive the best possible negotiated price for services and drugs. Regarding your drugs, make sure to ask your doctor for generic or low-tier prescription drugs. Not only do these cost less, but oftentimes deductibles will not apply to these lower tiers, helping to save money again in the long run. Finally, if a generic or low-tier prescription drug does not exist for what you are being prescribed, reach out to the manufacturer. Oftentimes, the manufacturer offers coupons that you can use at the pharmacy to, again, help save money. If you need any financial assistance, feel free to reach out with the Extra Help program. This is a low-income subsidy that helps pay Medicare Part D costs. Along with Medicaid, the Extra Help program is one of the two ways that you can remove a Part D late enrollment penalty. The Medicaid program is another great way as it provides healthcare coverage for people with and families with limited incomes. The programs do vary by state. The Medicare Savings Program also helps pay for Parts A and Part B. Finally, the PACE program provides care and services for elderlies living in the community. I encourage everyone to reach out to their local SHIP office at shiphelp.org or call 1-800-MEDICARE for any help with any of these financial assistance programs. Finally, additional resources can be found at medicare.gov. You're also welcome to contact your local Social Security or Medicaid office. GetMedicareResources.com is a great place to find Medicare checklists and worksheets to make sure that you're receiving all the benefits you can receive. For local resources, please feel free to reach out to one of these agents. Additionally, Bruce Moeller of the Indiana SHIP is a spectacular resource, and I encourage everyone with questions to contact him. On behalf of myself with Aaron Cook Insurance and the Marion County Coalition on Aging, I thank you all for partaking in this video series. If you have any questions, please do not hesitate to reach out. Thank you.